Hello and welcome, my dear friends. Today, we're going to talk about a topic that changed the world. One that affected every home, every person, and every heartbeat. The COVID-19 pandemic. What is a pandemic? What exactly is COVID-19? How did it spread so quickly? And why did it cause such global concern? As your virtual doctor, I'll guide you gently and clearly through this important topic. Don't forget to like, comment, and subscribe if you find this helpful, because health education saves lives. Now, let's begin. What is a pandemic? A pandemic is a widespread outbreak of an infectious disease that affects people across many countries or even worldwide. In simple terms, when a virus or bacteria spreads rapidly across borders, infecting large numbers of people, it becomes a pandemic and can pose a serious threat to public health. What is COVID-19? COVID-19 is a respiratory illness caused by a new type of coronavirus SARS-CoV-2. It was first identified in late 2019 in China, and it quickly spread around the world, turning into a global pandemic. COVID-19 spreads mainly through respiratory droplets released when an infected person coughs or sneezes, touching contaminated surfaces, then touching your mouth, nose, or eyes. Infected people may experience mild symptoms similar to a cold or flu, or severe illness such as difficulty breathing, shortness of breath, high fever, pneumonia, lung inflammation, and in some cases, even death. If you'd like, I can also explain how to protect yourself from COVID-19. The role of vaccines, personal hygiene, and prevention tips. Section 1. How did COVID-19 begin? COVID-19 is caused by a virus called SARS-CoV-2, a new type of coronavirus that affects the human respiratory system. It was first detected in December 2019 in Wuhan, China. Scientists believe the virus originated in wild animals, most likely bats or pangolins, and was then transmitted to humans. Once it infected people, it spread from person to person through the air by coughing, sneezing, or even breathing near others. Section 2. How did the virus spread? In the beginning, the outbreak was local, but as people traveled between cities and countries, the virus spread rapidly across borders. Within just a few months, it reached nearly every country on Earth. In March 2020, the World Health Organization (WHO) officially declared COVID-19 a global pandemic. Section 3. How much harm did COVID-19 cause? According to official data from the WHO and CDC as of 2024, over 700 million people around the world have been infected. More than 6.9 million people have lost their lives. In the United States alone, over 1.1 million deaths have been reported. And even today, many people who survived COVID still suffer from long-term symptoms like shortness of breath, memory issues, chronic fatigue. This condition is now known as long COVID. What is the connection between COVID-19 and climate change? COVID-19 was not directly caused by climate change, but environmental and climate-related factors have indirectly influenced the emergence, spread, and severity of the virus. 1. Disruption of wildlife habitats. As humans cut down forests and expand into natural habitats, they come into closer contact with wild animals. This increases the risk of zoonotic diseases, viruses that jump from animals to humans. COVID-19 is believed to have emerged this way, possibly from bats or pangolins. Climate change also pushes animals to migrate to new areas, making virus transmission more likely. 2. The role of air quality. COVID-19 attacks the respiratory system. In areas with poor air quality, high levels of PM2.5, the disease tends to become more severe. Some studies found that mortality rates were higher in polluted regions. This shows how environmental damage can weaken the immune system, making people more vulnerable to infections. 3. Global climate and pandemic risk. Climate change is expanding hot and humid zones, ideal conditions for the spread of viruses and microbes. In addition, floods, droughts, and other extreme weather events are forcing people to migrate. Large-scale movement increases the speed and reach of viral outbreaks. 4. How did the pandemic affect the climate? During the global lockdowns in 2020, transportation, industry, and flights decreased sharply. Carbon emissions (CO) dropped temporarily. However, this was only a short-term improvement. Emissions returned to high levels once restrictions were lifted. Conclusion: COVID-19 was not caused by climate change, but environmental degradation and global warming increase the risk of future pandemics. The way we treat the planet reflects in our own health. Caring for nature is caring for ourselves. What should we pay attention to during a pandemic? The COVID-19 pandemic is not just a disease. It was a serious test for our society, environment, and overall health. To protect ourselves and others, every individual must follow these essential health guidelines. 1. Wear a mask properly. Always wear a mask that fully covers your nose and mouth. Change it every 3 to 4 hours or wash it if reusable. Wearing a mask is not only about protecting yourself, but also everyone around you. 2. Wash or disinfect hands frequently. Wash your hands when returning home, before eating, or after coughing, sneezing. Use soap and water for at least 20 seconds, or disinfect with an alcohol-based sanitizer. Clean your phone keys and door handles regularly. 3. Keep social distance. Maintain 1 to 2 meters of physical distance from others. Avoid crowded places, unnecessary gatherings, or close contact whenever possible. 4. Stay home. Limit unnecessary movement. Postpone non-essential trips and stay indoors more often. If you experience symptoms like cough, fever, or fatigue, stay home and contact a doctor. If possible, switch to remote work or study from home. 5. Boost your immune system. Eat nutritious foods, vegetables, fruits, green tea, and foods rich in vitamins C and D. Sleep well, reduce stress, and stay active. These all help strengthen your immunity. 6. Pay attention to symptoms and seek help. Common COVID-19 symptoms may include dry cough, fever, difficulty breathing, loss of taste or smell, headache, and fatigue. If you experience even one of these, do not self-medicate. Contact your doctor immediately. 7. Get vaccinated. Vaccination is one of the most effective ways to protect yourself from severe illness. It also increases community immunity, helping protect those around you. A kind word from your doctor. Protecting yourself and others during a pandemic is not just a rule. It's an act of love, care, and responsibility. Every small effort can help save a life. How to maintain a healthy lifestyle during a pandemic. A pandemic is not only a serious health threat, it's also an opportunity to show care for yourself, especially when we spend more time at home. Healthy habits can help keep both your body and mind strong. 1. Focus on a balanced diet. Eat fresh vegetables, fruits, whole grains, and protein-rich foods every day. Reduce sweets, fatty meals, and fast food. Control your intake of salt and sugar. They directly affect immunity. Prefer steamed or boiled meals instead of fried ones. 2. Drink plenty of water. Drink at least 1.5 to 2 liters of clean water daily. Try healthy drinks like warm lemon water, green tea, or turmeric-infused water. Completely avoid sugary or carbonated drinks. 3. Stay physically active even at home. Aim for at least 30 minutes of light physical activity per day. Yoga, dancing, stretching. Even at home, move around, walk the stairs, do gentle exercises. Movement boosts blood circulation and improves mood. 4. Prioritize quality sleep. Sleep 7 to 8 hours each night to allow your body to recharge. Avoid screens, TV, phone at least 1 hour before bed. Poor sleep can lead to stress, weight gain, and fatigue. 5. Care for your mental health. Limit exposure to negative news and spend more time with positive, uplifting content. Practice deep breathing, meditation, prayer, or calming music. Stay connected with loved ones. Even a video call makes a difference. 6. Don't forget hygiene and prevention. Wearing a mask, washing hands, and keeping distance should become part of your healthy routine. Regular vaccination and taking immune-boosting vitamins can support your body's defense. A final word from your doctor. A pandemic is not here to weaken you. It's a reminder to restart your healthy life. Value yourself. Every healthy choice is a victory. COVID-19 and its subvariants 2.0-5. 1. COVID-19 is not over, but now in an endemic phase. COVID-19 has shifted from a pandemic to an endemic, meaning the virus is still circulating, but it's no longer considered an acute global emergency. As of summer 2025, both in the United States and worldwide, hundreds of new infections and deaths are still being recorded each week. 2. New subvariants have emerged. NB.1.8.1 Nimbus, part of the Omicron family, currently labeled as a variant under monitoring. This is the dominant subvariant in the U.S., responsible for about 37% of new cases. It spreads quickly, but there's no strong evidence suggesting it causes more severe illness. XFG stratus, detected globally in 22% to 40% of new cases. So far, it appears to cause mild symptoms and does not significantly increase hospitalization rates. 3. Current status spring-summer 2025. COVID test positivity rates have increased in some regions, reaching up to 11%. Many cases are mild, but some people, especially the elderly and immunocompromised, still require hospitalization. Updated vaccines and antiviral medications such as Paxlovid are proving effective in reducing the severity of the illness. 4. What should you do? 1. Stay up to date with vaccinations, especially the latest formulation designed for current variants. 2. Get your booster doses, particularly if you're over 60 or have a weakened immune system. 3. Continue hygiene and prevention practices. Wear a mask in crowded or poorly ventilated spaces. Ensure proper ventilation in indoor areas. Stay home if you feel unwell. 4. Use antiviral treatments as prescribed. Medications like Paxlovid can help prevent severe outcomes when taken early. Final thoughts. COVID-19 is still active, though no longer a new disease. We are now in the endemic phase, where new subvariants like Nimbus and stratus continue to emerge. While most cases are mild, vaccination, immunity, and proper treatment remain essential. Maintaining good hygiene and awareness is still very important, even in 2025. If you found this information helpful, don't forget to like, share, and most importantly, leave a kind comment below. I'd love to hear your thoughts. And of course, hit that subscribe button to stay connected, because your health deserves love, knowledge, and care every single day. Thank you for watching, and remember, a healthier you begins with a single, kind step. See you in the next video.